Okay.
Hi, my name is Sandy Meister, physical therapist with Care First. This is my client Ravani. She has low back pain, which is 80% of Americans have low back pain, specifically degenerate joint disease. So today I'm going to be showing you some exercises to help with her back pain, some stretching and strengthening. We're going to be also going over proper body mechanics and postural exercises. Okay, in our low back. So what's important as far as with the lumbar area is to keep the hamstring nice and flexible. That hamstring is right in the back of your leg. Okay, so our first exercise we're going to do today is stretching out that hamstring. Okay, keep that knee bent, this one nice and straight. Okay, she wants to pull up her leg until she feels a nice stretch right back here. Not where it's painful, but where she feels a nice stretch. As the muscle relaxes, she will gently pull her leg a little bit closer towards her. And we hold for about 20 to 30 seconds. We'll do that 2 times on each side. So while she is stretching, you want to make sure that you're not holding your breath. You want to be breathing in through your nose for about a count of 2 and out through your mouth a count of 4. So just bring it right up and holding. And again, due to we become so inactive and we're sitting a lot in front of the computer, our hamstrings are becoming very tight. So this is an extremely important exercise to do to really help prevent low back pain, or if you have back pain, alleviate it. Good. Okay, now we'll go ahead and do the other leg. Keep that knee nice and straight and bringing it up again until you feel that nice stretch. There's several ways you can stretch that hamstring. You can do it this way. And we have a specific strap that we use that has a little holder for her foot. If you don't have one of those, no big deal. You can just use like a nice long beach towel or any kind of towel. Another way that you can stretch your hamstring is just putting your leg right up on a stool and then bending forward. So it's whatever the client is most comfortable with. Good. And go ahead and bring it up again. So you have to incorporate stretching and strengthening. And while she's stretching her hamstring, I'm going to go over some proper body mechanics. When you're standing, you want to stand, and I always crack up when I say this, nice and tall. So if I had a string pulling from the top of my head, I want to be like this, everything in alignment. Even in sitting position, you want to be like that. When you're lifting any item, you want to make sure that you contract your abs, okay? Your feet shoulder width apart. You bend down, you pick up the item, and you come straight up using your legs. Far as sleeping, it's very important to sleep on your back with your knees bent. You put a pillow underneath your knees. Another position that's excellent for your back is what they call a fetal position. That's being on your side with your knees slightly bent with a pillow between your legs. One last thing, and it's really simple, if I'm walking, instead of twisting to turn, you want to take baby steps. So if I'm going this way, I want to change directions. I just want to take nice little steps and go this way. Twisting is really hard on your back. So a lot of golfers, they tend to have low back pain, or anyone using improper body mechanics. Good. Okay, we're going to get into some core work. Strengthening your core is another very important element to do to help prevent low back pain. And we're going to do what they call a crunch. And I'm sure everyone's familiar with a crunch. So we're going to start out with level 1, and that's your hands across your chest like this. When Ravani comes up, she's going to blow out. It's extremely important when you're doing the exercise to blow out on the effort aspect of it. So she's going to come up, her shoulder blades up off the table, blowing out. Hold it for a good second. Good. And then go down. We're going to do that about 5 to 10 times. And what that is doing is strengthening her core muscles, okay? And the stronger you have your muscles, that's what supports our skeletal system and supports us. You know, we all have wear and tear, and that's just age, which I think is a beautiful thing. But we got to make sure that we use our muscles and keep them nice and strong, and you can stay at a very high functional level like Ravani has in her life. So she's just coming straight up. The next exercise we're going to do is she's going to take her right shoulder going to her left knee and holding it and down. And that's working her sides of her stomach. Yep. And make sure you come a little bit more straight up. Like that. Good. So again, we want to avoid that twisting aspect of it. And hold it for a good second and then go down. And you start out with about 5 to 10 reps. And then as you get stronger, you just gradually increase that, like 2 reps each week. Good. Go one more on each side. Okay. The next exercise we're going to do is called a pelvic tilt. It's a very simple exercise, but extremely important. What she's going to do is take her lower back, her lumbar area. She's going to press down into my hand, squish my hand, yep, and hold that for about 5 seconds. So 5, 4, 3, 2, 1, and relax. Go ahead and just do that 2 more times. And again, this is strengthening her back extensors and the front of her core. Good, and one more time. So with the strengthening and stretching exercises, it's also critical to incorporate cardiovascular activities. For example, riding the bike is excellent, swimming, the elliptical, walking. So besides doing these exercises, someone must incorporate like 3 times a week the cardiovascular activities, and that will really help prevent low back pain. Okay, our next exercise we're going to do is Ravani's going to do the pelvic tilt, and she's going to bring both knees to her chest and hold that for about 10 seconds. And that is stretching all this back posterior area of her body. Good. And go ahead and go down. We'll do that one more time. Do the pelvic tilt. Yep. And down. Okay, and then our last exercise we're going to do today is she's going to lift her bottom up towards the ceiling and hold that for about 5 seconds. Excellent. And this is a real important stabilizer of the pelvic area, which again will really help prevent low back pain. Good. And again, up nice and high. Holding. Good. And generally with our clients, we have lots of modalities that we can help with our with the person's discomfort. After 72 hours someone has hurt themselves, we generally put them on heat for about 20 minutes. We have like TENS units we can use, ultrasound, massage, a lot of different modalities to really help with someone's discomfort. So with this whole routine, Generally, for most people, it only takes about 4 to 6 weeks, and then we discharge them. They're independent with their home exercise program, and then it's a matter of them to follow through. And usually, they'll never have back pain again. So we work hard here at CareFirst to help everyone out. Thank you.